Namaskar. I am Dr. Ankit Parakh and I work as a consultant in pediatric pulmonology, allergy and sleep medicine at Children's Chest Clinic, New Delhi. So in this video, we'll talk about a common problem in children which is chronic urticaria. Now as we know, urticaria or hives is usually short lasting. So children get urticaria frequently. It happens in relation to viral infections like a viral upper respiratory infection or a common cold. It can happen with a gastroenteritis, or sometimes the cause of urticaria may not be clear. But occasionally, this urticaria can repeat itself frequently, or this urticaria persists in a few children beyond 4 to 6 weeks. And then we call this urticaria as a chronic urticaria. So, what are the reasons of having a chronic urticaria? Well, in most children, the cause of chronic urticaria is known as idiopathic, which means that science does not know why it exactly happens. The most common variety of urticaria, hence, is idiopathic or spontaneous, where it just happens. The other causes of urticaria could be chronic inducible urticaria, which means that it happens in relation to exposure to heat, exposure to cold, exposure to pressure, and fewer more conditions. The other common question which parents wish to know is that if my child is having recurrent hives or urticaria, does it actually indicate an underlying serious disease? Well, as I said, urticaria usually is idiopathic and usually it does not signify an underlying serious disease. But occasionally it can be a manifestation of an underlying disease which can be related to autoimmune diseases of thyroid, juvenile idiopathic arthritis, or systemic lupus erythematosus, but these conditions are definitely rare. How do we treat a child with chronic urticaria? The basis of treatment of chronic urticaria is usually medicines which are known as antihistamine, and these medicines actually reduce the histamine inside the body. These medicines are available as cetirizine, levocetirizine, and there are newer medicines such as bilastine, ibastine, and fexofenadine. These medicines are quite safe, and we need to understand that these medicines need to be used regularly to have a good relief in symptoms. It also needs to be understood that all these medicines are absolutely safe in children, and research has been done for many years which shows that even if it is used for continuously for years, it does not carry any side effects. Now, there can be occasional children where the antihistamines medicines are not completely effective, and despite increasing the dose of these antihistamines, children persist to have urticaria. Now, in these situations, we have newer options. So, drugs like cyclosporin can be used, and the other option is a newer biological drug, which is an anti-IgE medicine, which is called as omalizumab. The last question is that does this chronic urticaria actually go away? Well, it is very disturbing for parents to understand that urticaria can last for a long time. But research has shown that most children will actually remit the urticaria, and gradually they will get well and remain well. But the exact time duration when this urticaria is going to remit and go off the child is sometimes difficult to predict. So if your child is having chronic urticaria, you need to consult an allergy specialist to understand the causes of urticaria and get a proper treatment. So for more information, you can log on to our website ankitparakh.com. Thank you.